Hello, I'm Dr. Brian Connor. I am an assistant professor of nursing here in the College of Nursing at MUSC. I've been a nurse for 33 years. I spent many of my years in the clinical arena in critical care units, also as a leader and manager in critical care areas and administration, and then I've been in academia, been a faculty member for nearly 10 years. I will also be serving then as the course coordinator for your course NURSU 428, Practicum in Clinical and Management Decision Making, that you'll have this summer, in the summer of 2016. So the purpose for this very brief video today that you'll be viewing while in Dr. Anderson's Research and Evidence-Based Practice class is to help prepare you for this NURSU 428. It's your capstone course this summer. It's a course made up of 90 clinical hours. You will have content in Moodle, but basically the idea of those 90 clinical hours is you're already nurses. You don't have to do clinical hours taking care of patients. You'll be using those clinical hours to develop a quality improvement project, a quality improvement pilot project, something that's fairly brief, not a large project, because we want you to get it done during this summer semester so that you can graduate in hopefully in mid-August. So the purpose for this video today is to give you some vital information that hopefully will help you during this research and evidence-based practice course to use your time efficiently and wisely in what you learn in this course that will hopefully help build on the project that you hopefully will eventually tackle for your project in NURSU 428. So let's get to it. Let me just give you some of this brief information. Hopefully most of you have been involved in some way, shape, or form in quality improvement. Whether you're at MUSC or the other hospitals, I know that MUSC has a strong history of nurses being involved in quality improvement. But for the purposes of your RN to BSN degree, for gaining your BSN degree, we think it's vital that you learn, master, able to demonstrate your ability to develop and implement a quality improvement project that hopefully will lead to some type of improved patient outcomes. Might be improving patient safety, might be improving quality, but the whole idea is to work on a project, hopefully, fairly brief project, but something that will really benefit patients in the long run. So hopefully it's twofold. It's not just that it's a course that you have to go through to be able to graduate, but hopefully you're able to do something. Our real goal is for you to do something tangible, something that will really be of benefit to the area where you work, to your manager, educators, to the physicians, the providers, and certainly overall something that will really benefit the patients in your facility. So that's the purpose of the Practicum course this summer. And so to get ready for that, as you're going to go through the research and evidence-based practice course, you're going to be developing a Pico question. I'm not going to go into that detail right now. If you're not familiar with the Pico format and what a Pico question is, Dr. Anderson will be teaching you that. But the key is that what will really help you most as you begin to allow a Pico question to help guide you to do a bit of a literature search to find best available evidence on a clinical issue, what will really help you most is if you can build this toward a project that you will actually be working on. So in the past when we've done this, we have some students that do a great job at identifying a clinical issue, talking to their manager, talking to other nurses, talking to the educators, talking to physicians, and certainly even talking to some quality improvement people if you're able to do that, infection control people, somebody that can guide you in a way to say, here's a small project, here's an idea, here's something we've been working on. Maybe you can latch on to what somebody else is doing, but carve out a little bit of that for yourself that will be your project. So those are some ideas, but if as you go through this research and evidence-based practice course, you are going to develop this Pico question. So other students haven't been able to identify their issues, so they basically developed this Pico question in this course and go through the research and evidence-based practice course with an idea or working on an issue that turns out to be something that they're not able to work on for their project. That kind of makes double work for you. So we understand it's not always going to be possible for 100% of students to identify the clinical issue that they eventually want to do their project on, to be able to use this course to find evidence to see what's the best intervention to hopefully improve some type of patient outcome for safety or quality. So, but we just want you to be thinking that way right from the start of this course, that if you haven't done it up to now yet, and we hope that you have. Some of you may have already been thinking about this as you've been in this curriculum, in this program, and maybe you already have your ideas, so that would be great too. But if you haven't, now's the time to start sort of immediately with talking to coworkers, talking to your nurse managers, directors, educators, clinical nurse specialists, whoever that might be around you that is involved in quality improvement. And certainly there are quality improvement people, performance improvement people in every institution. Every hospital has a quality department. It might be for nursing, a performance improvement department. There's sometimes quality improvement people that are involved with physicians. For example, at MUSC, Dr. Danielle Shearer has a title, and I'm not sure exactly what it is, but I think she's sort of the director of quality improvement for the medical staff. But she is always happy to work with nursing staff as well. She's a great resource to identify what maybe some potential projects might be. There's also at MUSC a person named Jennifer Hooks who works in quality improvement with the medical staff. And then there's a performance improvement group. And then if you're not at MUSC, I'm sure that if you don't know yet, your manager, your educator, someone can help you identify who is the quality improvement, who are the quality improvement people that I can talk to. Even it may just be infection control people that you talk to about a particular clinical issue. But the idea is you want to identify a clinical issue, a potential problem area, and something that's kind of small. You don't want to work on something that's going to take months and months because you don't have that much time. The key is having access to data. So as you talk to people and you think about a potential clinical project, you want to know, is data accessible? Can I get to some aggregate data? Aggregate data means it's de-identified. You're not trying to use any patient identifiers, any individual patient information. You want some kind of aggregate data. For instance, you might want to know what are CAUTI infection rates, catheter-associated urinary tract infection rates. You might want to know those are collected. That data is accessible. You might want to know about falls. Those are just some examples, and there are plenty of medication errors. There are plenty of things where that kind of data is gathered, and it's not specific to individual patients. It's what we call aggregate data, and it's data that is typically easily accessible, because the idea in developing a quality improvement project is to have pre-intervention data. So that's data that you collect before you implement something new, an intervention that's hopefully evidence-based, that is a change in practice, a change in doing something. So for instance, one of our students last year used a nurse-driven protocol to remove catheters, and was able to get medical staff approval for this, to develop and use this. This actually didn't have to develop it. It was a nurse-driven protocol already developed. All they did was get approval to implement that, using that nurse-driven protocol to remove catheters anytime after 48 hours if certain parameters are met. And so they have some data beforehand about duration of catheterization, mean average days of dwell time of Foley catheters. Implement this nurse-driven protocol, and then over several weeks, maybe 2 months, maybe 6 weeks, let's say, and then look at the data afterwards to see if they were able to, in this case, reduce the duration time. The whole idea is the less duration that a catheter is in place, the less likelihood that a patient will develop a UTI. Or a CAUTI. So that's just one example. Wanted to give you sort of an example of a project, a clinical issue, an idea, falls, it could be something, any other types of infections. You have to talk with the people around you and try to find some clinical issue, hopefully something you're passionate about, something that matters to you and that matters to the people around you in the unit. in this course, the Research and Evidence-Based Practice course, then you're going to develop a Pico question that will help identify the population, the potential intervention, the outcomes, and that's key, is understanding what are the measurable outcomes, what is it that you want to change in order to make an improvement. So the more work you put in during this course, the better off you'll be at being ahead of the game when you get to NURSU 428 that will start this summer. So I hope this has given you a brief idea. That's really the only purpose to put this out there right now. Dr. Anderson will be giving you some more information about that, but I think that we just wanted to begin to explain to you what your summer course, your capstone course will look like. Please get in touch with managers, your educators, clinical nurse specialists, and any QI people that you can identify to help you start thinking about what's a small project I could work on, and how could I, what data can I gather, and you start thinking about it to plan for that now. So thanks very much for listening. I look forward to seeing you in NURSU 428 this summer.